much. So I think now we are going to start again, and this session is the webinar SEAOHUN VCoP 2 webinar, and this session is being recorded, and this recording will be posted to the SEAOHUN website. And let me introduce myself again. I'm Maureen. So we are going to I would like to request that you rename yourself as a country and then followed by your name, so that this will be helpful for us to manage the small group sessions in the later part. Thank you for that. And we'd like to request that you also keep your audio muted throughout the webinar so that it will be helpful. And instead, you can use the chat button to ask any questions or drop the questions. And you can use the show caption buttons to enable the transcriptions. Lastly, we will have the link in the chat box. Sorry, I believe that there is a link where you can download the agenda and Zoom backdrop. So later in the session, we'll be having the group photo, and please be prepared to change the Zoom background and to get involved in the group photo session. Okay, thank you so much. So let me move forward to the next agenda items. Let me invite to Miss Anti Rismayanti, our program manager of the SEAOHUN Secretariat, to give the opening remarks. So over to you, Anti.
Okay, thank you, Maureen. And a very good morning to our distinguished speaker, Alicia, and good evening to our participants. First of all, on behalf of Dr. Fat, I would like to give a welcoming remarks, and Dr. Fat is unable to attend our VCoP webinar today. So I would like to extend our warm welcome to all of you to this empowering webinar on breaking barriers, advancing gender equality, and empowering young women in One Health careers. Today's event marks a significant milestone in our ongoing virtual community of practice program, which aims to foster student engagement, not only students, but also the professional engagement and collaboration across Southeast Asia, enabling us to share knowledge, discuss pressing One Health topics, and find innovative solutions to complex health issues at the interface of human, animal, and environment health. Our VCoP webinars today are designed to bring together students or professionals like yourself who possess a deep passion for One Health and a shared commitment to making a difference. Through this virtual gathering, we create a vibrant space for open dialogue, exploration, and learning, transcending geographical boundaries to address the most critical challenges we face as a global community. Today's session is particularly meaningful as we delve into the impact of gender of young women's career development in the One Health sector. We seek to address two provoking questions. Do women and men make different career choices? Is it more challenging for young women to find their first jobs compared to their male counterparts? And what factor plays a greater role in shaping your future career and prospects? Is it your competencies or your gender? Moreover, how can we collectively prepare ourselves for the future transitions into a job market, ensuring a level playing field for all aspiring One Health professionals? Throughout this webinar, we aim to achieve several objectives. Firstly, we will explore how gender dynamics unfold within the realm of career development in the One Health sector. By analyzing and discussing these dynamics, we can gain a deeper understanding of the challenges and opportunities that young women encounter as they navigate their professional journey. Secondly, we will engage in conversation surrounding the barriers that hinder the realization of women's full potential within the One Health workforce. By openly addressing these barriers, we can actively contribute to empowering both young women and men to advance their One Health careers, fostering an environment that embraces equality, inclusivity, and diversity. By participating in this webinar, each one of you, I believe, is an agent of change, contributing to a global movement striving for gender equality and empowerment. Your presence today demonstrates your commitment to shaping a future where all individuals, regardless of gender, of course, can thrive and succeed in the One Health field. I express my sincere gratitude to all the students and professionals that attend our webinar today, and of course to our distinguished speaker, Alicia, and SEAOHUN Secretariat team who have made this event possible. Together, we can drive positive transformation, inspire one another, and create a world that recognizes and values the immense contributions of young women in One Health career. Thank you for joining us today, and let us embark this enlightened journey of exploration, discussion, and empowerment. Thank you very much, and back to you, Maureen.
Thank you so much, Andy, for your warm welcome remarks. Thank you very much. So now we are going to have the groups photo session. So I hope you have already downloaded the Zoom backgrounds and have changed the background if it is possible. So please, can you turn on your camera? So just for a while, we'll have a quick snap. Let's give a few seconds. If you are not able to download the Zoom background, I think it's fine, totally fine. You can join with the video, the background, original background. All right. So, okay. I'm going to have it. Yep. Okay, ready? Are you ready? Keep on smiling. Ready? 1, 2, 3. 1, 2, 3. All right. Thank you so much. That was very pretty. Okay, so now we are going to have a very fun activity sessions. So let me pull my slides. We are going to have the ice-breaking activity and the pre-test quiz. Hope you get the link in the chat box. And then we would like you to enter the link. And then when you get into the link, please hit the heart button so that we can see how many of you are there. Can you see my slides? I hope you can see my slide. Yeah. Okay, great. So there will be 5 questions for the pre-test quiz. We will have the 30 seconds for each question. And so since this is just a pre-test quiz, there will be no answer provided. So, but before then, let me quickly check you with all the countries where you are joining from. Philippines, Thailand. Okay, Philippines bigger, so it's mean a lot of people from Philippines. Indonesia. All right. Anyone else? Philippines, Thailand, Indonesia. Okay, I cannot type and yeah, so majority. All right. Okay, it's good to know. Malaysia, Vietnam. Amazing. Okay. Great. 1, 2. So 5 countries you're joining from. All right. So let me move to next question. Okay, so let us see what is your area of disciplines. So which will help us to know from which discipline you are representing. Okay, let me open the vote. Okay. Human health, animal health, environment, others. Okay, majority are from the others and known disciplines. Human health, 33. Okay, it's tied. Okay, coming up with the others. Amazing. Okay. So I think we are ready to have the quiz, pre-test quiz. If you are ready, be get it to have the answer, and I will give them 30 seconds for each question. So is it the statement, the following statement is true or false? You don't have to worry, you just think whatever is you feel is correct or incorrect, just vote it. False 50, true 50. Amazing. Okay. Okay. It's going to close. 1. Okay. Time's up. So good. We are going to have another question for 30 seconds. What is the gender pay gap? Is it A or B or C or D? A. You think so? I'm just kidding. You can just answer anything. Later, we can figure out the answer from the presentations that Alicia will be giving. So, okay, see? Okay, 57%. 4, 3, 2, 1. All right. Time's up. Okay, moving on next item. What could be a likely explanation of why women are experiencing overall lower employment rates globally? How do you think? What do you think? What could be the reason? A, B, C, D.
Maybe you can read the variants because they're the type, the font is so small.
Oh, I see. Yeah, maybe, but on their screen, I believe it is a bigger version. Yeah, with the mobile. All right. Thank you. So moving on next item, we're gonna have it. I'm gonna read. What is an estimated proportions of women in health workforce globally? I believe this one is quite easy for you to guess. All right, 100%, 70. Oh, sorry. Okay, 50%, 30%. That's good to know. 4, 3, 2, 1. All right, time's up. Okay, this is the last questions. I believe is quite long, but you have to think carefully and you can answer. Currently in the Southeast Asia, there is a high level of women enrollment in post-secondary education. As time progresses, these women will grow their academic and professional career. The number of women in leadership position will automatically increase in the future. True? True or false? True or false? False or true? Okay, majority have answered true. All right. Okay, thank you so much. I think it's very kind of wonderful that we have got to know from the quiz, and don't worry if the anything like you have made the confusions, so we will have the more explanation from the presentation. So next up, we are going to have the best part of the sessions. We're going to have the presentation from Alicia. So I would like to invite Alicia. Alicia, let me introduce Alicia Kuchiner. She has over 15 years of international work experience in sexual and reproductive health and rights, gender equality, gender-based violence, intersection of gender and One Health policy and advocacy. She is a current PhD student at the Department of Sociology, University of Alberta, Canada. And she recently graduated with an MA degree in gender and social justice from the same university. Also a former SEAOHUN program manager, Coach Kina has experience in conducting gender analysis, policy research, developing programs, and policy development. So one of her most recent research was conducting 2023 gender assessment of veterinary services in Southeast Asia for one World Organization of Animal Health, WOA, which is forthcoming. So let me invite Ulyssa.
Thank you. Thank you so much, Maureen, for your kind introduction. And thank you to all SEAOHUN staff for having me here. It's really my great pleasure. And so, yes, I will echo what was just said, and I am very grateful for all the participants joining, because I believe you are the agents of change, and your presence here really shows your interest in the topic and your willingness to make the change in the future. I will, oh, where is my slide? 1 second, I will find my slide and share it. And we will start the discussion. I hope to see your active participation today. I planned it the way so that you can also express your opinions, your thoughts during this presentation. So I want to make it interactive, not just me talking, but you also chiming in. And please feel free to unmute yourself if you feel comfortable at any point and ask a question. Or if you have a question and you don't want to unmute, just type in the chat. Maureen will help me monitor the chat if I don't see some questions, but I will definitely pause to talk about it. So this is not just me talking, but us talking together. Great. So let's start. Again, my name is Olesya Kochkina. I was working with SEAOHUN for some time, and it was my great pleasure. Before that, I worked in many different organizations, including in UN. But it was at one point of my career, I had a family, I had a small child, and I decided to quit from international work, from any work. I stayed home for some time, and I was just being a mom. And after that, I decided, no, I have to go back because I want to advance my career as well. And that's also at that time, I decided to join academia again and continue my education. So in addition to my previous diploma, which was in journalism, I got a degree in gender and social justice, just like Maureen recently said. And I decided to continue it with PhD. So I'm telling you this because I think this is also an illustration of, gender scenario within profession. Many women face this kind of trajectory in their experience. And I want to hear from you as well. I know you already, and I hope people are renaming themselves with a name and country, or country and name. Please do it if you haven't done so yet, because it's so wonderful to see how many countries are here. And also, if you can type in your field of study in the chat, that would be wonderful. Many people answered others, so I'm curious to see what those others are. I'm also happy to see that there are many people from veterinary or animal health sector. Just like Maureen mentioned, I recently conducted a study, a gender assessment of veterinary services for the Southeast Asian region for World Organization of Animal Health. And it was very interesting. This is not published yet, so we're not officially talking about it, but the WOHA, they generously allowed me to share some insights from this research with you today. and I'll be very happy to talk about it. So those of you who, I see already somebody is typing veterinary medicine. Thank you. Please, everyone, type your field of studies in the chat. So it's very interesting to see where you're from. So those who are from veterinary medicine, maybe you can see yourself a little bit in what I will be talking about. Public health, very nice. Please continue typing, and you can also type how you say hello or welcome in your own language. And SEAOHUN staff, please feel free to join this as well. It will be nice to hear all different languages and to see from Menglava. Yes, you, Maureen Menglava. Very nice seeing business management, human health, public health, veterinary, public health. Very, very interesting. Okay, keep typing and I will go ahead with my slides. And it's still very interesting to see what career paths you are into. So we'll start with the definitions very quickly because you know this already, I'm sure. People often mix sex and gender. These are different concepts. So sex usually refers to the biological characteristics, the hormones, you know, everything, the body structure, hormones, and chromosomes. All this defines sex, and usually sex is assigned at birth. There are different scientists, and some scientists see this also differently, but we don't go to those details. The common understanding is that this is assigned at birth, and there are only two biological sexes, although this notion is also challenged, but you can read about it in some articles if you're interested. However, gender refers to the characteristics, social characteristics of women, men, girls, boys, and it is believed, and I believe so too, that gender is socially constructed. People learn what does it mean to be a boy or a girl or a man or a woman, and this is different for different societies. So in some societies, they understand differently what does it mean to be a woman and what do women do, what they don't do. And this can change even within same society, but across time, this understanding changes. So your first question, whether gender is a static and doesn't change because of geography or time, this is not true. Gender is a very fluid social construct, and the understanding of what it means to be of certain gender, and even if it's only two genders or more, it depends on the society. It depends on where you are and where you're located. Okay, I still see that there are people from environment health and public health, and that's very interesting. Please keep typing this in the chat box. Next slide, I want to just very briefly connect gender with One Health. And this nice figure that you see on your slide, this is taken from practical actions to operationalize the One Health approach in the Asian Development Bank. It was published last year, 2022. Maureen can share with the resource later on if you would like to read more. But it really shows how gender fits in all this really complex concept of One Health. And ADB is also telling us that, well, we initially didn't think of gender when we thought of One Health, but it really fits there because of the interdisciplinary approach that One Health takes, because of the system thinking that One Health encourages us to do. And gender really does play a big role on how people interact with the environment, how they interact with animals, what role they play in this interaction. But also ADB tells us that we lack data to better understand the unique vantage point of women, because usually by default we present the world as it's seen by men. So yes, gender is very important for One Health, and I hope today we will uncover a bit of it. And now I really want you to engage with the chat, and I would like to ask you one question. Please write one example of a job that you consider, or not you, the society considers appropriate for a woman. Very interesting for me to see what people think about it. So what do you think? And SEAOHUN staff, you are also free to join. This is for all of us, interactive. Please type, what do you think, what kind of job is appropriate for a woman? Nurse, yes, agree. Again, this is what society thinks, okay? So it doesn't have to be what you think is appropriate for a woman, but nurse, again, babysitting, right? Any profession. Oh, thank you, Leomar. Yes, I agree with that personally, but you can also please write what you think, what's in your society where you live, what is seen like what is good for a woman. Economic, obstetric, gynecologist, yes, agree. Economic, by economic, like what exactly do you mean? Can you, Sarin Thorn, can you please specify, like, do you mean trading or what exactly economic? Teacher, yes, very good. Interior design. Flight attendants, oh, that's a nice one. Yes, I agree with all your examples. Now, please type one more. What do you think? What kind of job is appropriate or good for a man? That's another one. Engineer, yeah, engineer, 2 engineers. Military job, police, construction worker, right? IT jobs, excellent, great, amazing. That's all perfect examples. Thank you so much. Pilot, right? Continue typing. I'll just continue talking over here. So you're absolutely right. There are jobs that considered in society more appropriate for men and more appropriate for women. And this is called occupational segregation, when women are kind of channeled to one certain, not one, but certain career paths, and men are channeled to other career paths by their society, because they're told in their families, in their education system, that this is what's good for you, this is what is good for you. And it happens that women tend to be overrepresented in occupations that are perceived less skilled or low value, like care jobs, for example, cleaning, cooking. It seems for the society that you need less skills to do this type of job, and women, it feels like it's more appropriate for women in general, right, in the societies. So WHO estimates that in many countries, up to 70% of healthcare professionals are women. So those of you who answered in the poll, 70%, that was the correct answer. However, even though women dominate the profession in general, men dominate leadership positions. Women usually occupy in the hierarchy lower positions, like nurses. Somebody typed in the chat, nurses. That's correct. Oh, I like this one. President is appropriate for men. That's correct. And that's exactly reflects that the men usually are seen more fit for the leadership position in the society, right? Like the stereotypical role. Yes, so women in the health sector occupy nurses, midwives, health workers. And the other phenomenon is that it's okay for a nurse to become a head of the hospital, right? But the stereotype doesn't see it that way. So when women enter this career path, very often it blocks them there. And there was this research in Vietnam. It was pretty old, but I think some findings are still relevant. It is by International Labor Organization. It showed that women tend to be, young women, this was specific for young women, tend to be engaged in small-scale trading, light industrial manufacturing, agribusiness and services, like with livestock, for example. And men tend to be engaged in mechanics and more like industrial, heavy industrial manufacturing. And the WOHA, they conducted another gender research. I helped them conduct this year's gender assessment of veterinary services. There was another one conducted in 2015, 8 years ago. And one of the findings of that research was that women are seen as more fit working with small animals, with pet animals, domestic animals, smaller ones, and not fit to work with farm animals, larger animals. And even if we talk about domestic animals, women are seen less fit to work with like large dogs. So that sort of, maybe you've heard about this stereotype yourself sometime earlier. Okay, so we will continue. This is already from a little bit of insight from my recent research with WOHA. And this is what I found. In 2023, this stereotype still exists, but we talked with, we had a survey. We had a survey with 134 participants, students, and 65% of all women, so if we take all women participating in the research as 100%, 65 of them responded that they are likely to apply for work on a farm after graduation. So the stereotype that farm work is not for women is actually challenged by younger generation of women veterinarians. And also the second leading dream job that they told us that this is what they want after graduation. Yes, the first leading one was working with small animals, but pet animals. But the second leading, I was shared between the two options. 70% of women students said that they would like to work in private companies with livestock animals. Also 17% said that they would like to work with the government. So that was the difference between government and private ones. But this is second career choice for women. So the stereotype is not working. And I'm wondering if our education system would not tell us all the time that big animals are not for you. How many women would want to work with cows and horses and that sort of animals, right? So this is a lot of, when we say career choice, I'm wondering how much is it a choice or how much is it something that is forced on you, imposed on you, and told you that this is what you should be doing. Okay, so the time is really pressing. I probably will need to rush through my other slides. So the employment gap. Globally, there is a labor force gap. The labor force is considered when people who want to work and actively looking for jobs, how many of them are employed. So the current global gap in the labor force is 25%. But this is for all countries, right? This is not specific for concrete countries. So in this slide, you can see how big is the gender labor force gap in your country. We can share the slides later on, so you don't stop over here for too long. But this is not because of educational attainment. You can see from this slide that actually in many countries from which you are, women even outnumber men in post-secondary degree. This is about like bachelor level of degree, right? In some countries, they even outnumber. So why does this not translate into jobs? So ILO tells us that women who want to work have harder time finding a job than men, particularly in North America and Arab states. And also ILO and ADB said that even though young women are often doing better at school than young men, they are more likely to experience difficulties transitioning into employment. This was echoed by SEAOHUN tracer study conducted in 2018. And among their survey respondents, those who were unemployed, out of those unemployed, 75% were women. So we can see that this is actually happening. Okay, a little poll. Someone, Maureen, will help me with the poll, or somebody else. If you don't want to answer, you don't have to answer this question. I'm just curious to see from your perspective. So how confident are you that you will find your dream job within 6 months after graduation? If you don't want to answer, you don't have to answer. That's one. It is just a little experiment for us to see over here. We asked same type of question in the WOHA gender assessment that was just recently conducted. And I will share with you in a second how that went. So let's compare how you think and what people from the survey, the students from the survey thought. So currently we have very confident 29%, somewhat confident also 29%, neutral, I don't want to say 77%, and not so confident 36%. Nobody is not confident at all, and that's great. Okay, let's finish the poll right now. Thank you, everyone. Share results. Okay. Thank you, everyone who participated, and this was great. Now let me just quickly show you what happened with the same question in the research that we conducted recently. It showed that women are much less confident that they will get their dream job quickly after graduation. You can see the gap, like almost 20% between how confident men are that they will definitely get their dream job and women. And also in the not confident, you see like the orange part, the women much more not confident than men, which was, and this is about veterinarians, right? So we were talking only to veterinarian students. This was completely off the reality, because actually the research showed that young women veterinarians are finding their jobs somewhat even quicker. Not like this, like more women find jobs quick after graduation than men. So we asked already in-service professionals, and there were over 500 of in-service professionals. We asked them to say how soon they found their first job after graduation. And the choices were more than 12 months, between 6 and 12 months, less than 6 months, or other prefer not to answer. So women, the proportion of women who answered that they found their first job in less than 6 months after graduation was bigger than that of men, right? We don't know why, and to understand why women finding their jobs quicker, we would need an additional research and additionally to check. But you can see that you won't have a problem, especially those of you who are from veterinarians. They saw from the fall, from the initial questionnaire, right, that there were almost 20% over here. So if you're studying veterinary degree in Southeast Asia, not to worry. You are a woman, right? You not to worry. You will find your first job within first 6 months, most likely, right? The most likely. So don't worry. You should be confident. Okay, very quickly, and I don't know if we have time for group discussion. Maybe we will just discuss it among ourselves, but we want to go through the slides. Women facing glass ceiling. What is a glass ceiling? And if anybody has a response themselves, please put in the chat box. There is a gender imbalance, and specifically significant in STEM fields. And I would like you to answer, what is a glass ceiling? How do you understand it in the chat box? The Global Health 50/50 report in 2020 told that they analyzed 200 organizations like WHO and the leading, or Pfizer, the leading organization in the health field. And they realized that men constitute 68% of board chairs and 73% of executive directors, right? So with women being 70% in the field in general, but the proportion is reversed when it comes to top level management. And basically that's what is glass ceiling. When you grow your career to a certain point, but at a certain point you can't grow higher and you don't know why. And that's why it's called glass, because it's transparent. Nobody can see that it's there, but it's there. And there was also UNESCO reports about women in Malaysia. So women constitute 33% positions in senior management. And this is actually already very good. It's above the global average. And Malaysia, we've seen also from the many reports, including the one I conducted for WOHA, it's pretty advanced in women empowerment and women leadership. And there was another study. I'm very interested in veterinary sector now after this research. There was another research showing that in veterinary science, and we know that globally already women outnumber men in around among students in veterinary degrees. This is happening everywhere, including in your countries. But in these countries, in Australia, New Zealand, USA, Canada, Europe, where many women study veterinary degrees, like 80% of them students, only you can see from the slide, only about below half of them make it to the academic positions. And when they are in academic positions, they tend to be lower than men. So this slide I really wanted to show you. I thought it really illustrates, and the answer to your last question in the quiz, is it happening automatically that when we have more women coming into academia as students, it will automatically translate into women becoming high-level leadership positions later on? No. And this slide shows you, this is research in some German universities, but it's echoed by many other literature in the health sciences. So the enrollment, you can see that much higher for women than for men. And then as a progression goes with the degree goes up, the progression, the number of women go down, and around PhD, between like masters and PhD, it's already crossing. So then this type of diagram is called scissors diagram. So you can see like scissors, the progression goes really down, and a very high level academic very low participation of women, very low representation of women. So this is where the glass ceiling is happening. Very quickly about gender pay gap. So gender pay gap is not the difference in overall life earnings. Some of you chose in the response. It's the difference in the hourly earnings between women and men. So it was found that women tend to earn much less than men, even for same positions. And this is happening globally. And this is just from developed countries that give money to other countries themselves. But you can see the biggest gap in salaries is in Korea, actually. Okay, so we have very short time for small groups, right? But we try a little bit to start the discussion, and we can continue later. In P5, maybe you're preparing already small groups, right? So let's discuss, how do we achieve equity? First of all, I would like you to discuss, what do you think are the reasons why women are facing that glass ceiling in academia and in other professions, but maybe academia is closer to you because you are still a student and studying. So why? What are the reasons? What do you think? And then you can discuss what can be done to break these barriers for women in their career advancement. And then you can maybe give us some suggestions. What actions do you want to see happening for you, for yourself, for your women peer colleagues, to help them transition from education to employment and to break that career ceiling, right? Like when the PhD graph went down for women, what would you like us to do so that we can help it go up? So let's break into small groups, have a quick discussion. Hi.
We are getting back, yeah.
That's great. I think the discussion was starting to be really good. I am so sorry that we have so little time and we should have planned more time for this webinar, but it's late at night for you. So let's hear some comments from groups. And in our group, we had a participant who wanted to share something, and we are a small group anyway, so please feel free to share and unmute. But maybe we can start with seeing overall what the groups discussed very quickly. And PI, if you don't mind sharing quickly for our group where I was, just like a quick overview. Great. What we discussed. And you can also talk if you want to.
I think it was not right. You were talking and like discussing, so you can share what we discussed here. Yeah, please go ahead.
Oh, Noor, you want Noor to share? Just in the sake of time, let's go quickly. So we discussed that women were kind of considered more weak and emotional, and that's why the society doesn't see them fit for high level positions. And also because of pregnancy and childbearing, they sometimes take time off jobs. It's more difficult for them to come back. And as one of the recommendations, we had the regulations that would help women with their children, for example, childcare, something else that will help women go back to their jobs quickly. And Judith, do you mind sharing what you wanted to talk about?
Yes,
Or,
I'm sorry.
yeah. Oh, Noor, yeah, go ahead.
Yes. Hi, everyone. So my name is Noor Aziza Az-Zahra, but you can call me Noor. So I'm from Indonesia. Just want to share about my sister experience here. So my sister has been accepted for a certain job, but unfortunately the job say that you couldn't bring your child, and I mean in her work. So they consider what should she do, because she wanna still explore their ability, because she already have graduated for the doctor, but they still she still wanna explore their ability and improve, but absolutely she has limitation for that. So that's why I think it's very good for the certain work or job, like set the environmental situation that will be beneficial for women, like childcare. So on the other hand, my sister can focus on doing her job, and then there is a childcare too that she feel not worried about her child. Yeah.
Yes, absolutely. You're absolutely right. And we've seen that countries that have these policies in place that help women go back to their jobs when they're or when they have small kids, or don't break from their jobs when they have small kids. In these countries, these glass ceiling effects are less, and more women are in leadership position and more women are progressing. So let's hear quickly from the other group. And sorry for taking a little longer of your time, but we hope that you can still stay with us for this wonderful discussion.
Yeah, so from our group, I think we have selected one group representative. So from Vietnam, I think Ms. Tai Hong, would you like to share some key points what we have discussed so far?
Yeah. So we have a chance to discuss two questions about the reason why women are facing a difficulty in the career growth, and the first group had mentioned the women's facing like a gender role and responsibility as the household child and the duty being a mother, sister in family, and also they have the challenge in the pregnant periods like that. And women like tend to be less competitive than men, and we also discuss about the like the women in the leadership. They don't have like a few women take the leader responsibility, so women have less role model to look at or to be as a mentor.
Wonderful. Yeah, these are all great reflections.
And so we also discuss some solution to support women in their career growth, like we need to have the social cultural perception change. We need to have the support policy for women in the career, and also equip women with the soft skill like leadership, problem solving, teamwork, something like that. And we also empower women through the education and training and the equity in the workplace. Yeah, thank you.
This is great. Absolutely agree with everything, and actually resonates to what we've seen from the recent research that I conducted. Women were saying that we have to work harder than men, twice or thrice as hard as men, because whenever we make mistake, we are told, oh, it's because you're a woman. If a man makes mistake, they're told, oh, it's a human factor. Everybody makes mistake. But when we make mistake, we're told, oh, that's because you're a woman and you're not capable. So they have to work too hard to prove that they are capable. And actually with young women especially, because we found that young women face discrimination in the job place because of the double factor, because they're women and because they're young, and people tend not to take them very seriously. So that's true, and all your recommendations are great. Thank you so much for this work. We will keep all these slides and we will work further on them, and we can maybe come up with some ideas what we can do together to help you all, women, men, to progress better in your gender careers. And now I hand it over back to Maureen.
Thank you so much for this year. So, which is very fruitful discussions, and although it's the time is very short, but I hope that at least we can absorb something about our with the concept, and the discussion is very productive. So due to the time concern, actually I won't conduct the post test with the Mentimeter, but instead I would like to request that you kindly go into the link that will be jot form, which you can take the post test quiz, which are the same questions as we have answered before. So I hope this time you will have the better answers, and you will see the clear things from the presentation, from our discussion. So I hope that we will have the good result We hope that. So with that, it's the time we are coming toward the end of the session. So I would like to invite Auntie and for giving the closing remark and warm the goodbye for everyone. Yeah.
Thank you, Alicia and Maureen. This is a wonderful session of webinar tonight. And yeah, thank you for Alicia. This is an early morning there, but you are very great in delivering the topics today. It is very interesting. And as we draw this important webinar to a close, I would like to express our deepest gratitude to each and every one of you for your active engagement. Very short time, only 1 hour, and but all of you have a share insightful contributions and unwavering commitment to advancing gender equality and empowering young women in One Health careers. Throughout our time together, in a short time, we have explored the multifaceted nature of gender barriers, the importance of inclusive environments that just mentioned earlier, and then the need of the collective action to drive meaningful change. We have heard inspiring stories, for example, for one of our participants about her sisters and valuable perspective and actionable strategies to break down these barriers and create a more equitable world. So it is our shared responsibility, not only by one parties, but everyone, to carry the knowledge gained from this webinar and transform it into tangible action. Because we never know, maybe in the near future, some of you, it will be, having a position that can advocate for inclusive policies, mentor and uplift aspiring young women, and amplify their voices in decision making space. So by doing so, all of us will not only shape a more equitable future, but also harness the full potential of diverse talents, fostering innovations, and addressing the complex challenges of One Health with comprehensive solution. So I would like to encourage each of you to continue your personal and professional journeys with the same determinations and passion that brought us together today. And let us be, again, change of agents who inspire and empower future generations, ensuring that the barriers faced by young women are gradually dismantled and opportunities for growth and success are accessible for all. So before we part way, I extend my heartfelt appreciation to our distinguished speaker, Alicia, for sharing your expertise, experience, and wisdom. And your invaluable contribution have enriched our understanding and inspire us to strive for excellence. So lastly, I would like to extend gratitude to our organizing team, Maureen, Chan, Pai, and Wawa, and also Tura, and all those who have worked tirelessly behind the scenes of this webinar. As we bid farewell, let us carry the spirit of this webinar with us and continue our collective journey towards gender equality and empowerment in One Health careers. Together, we can break barriers, shatter stereotypes, remember, and create a future where young women can thrive and make their mark on the world. So thank you, everyone, and may we cross paths again in our shared commitment to more inclusive and equitable society. Thank you. And
Thank
goodbye.
you. Thank you so
Thank
much.
you.
And thank
Thank
you,
you so
SEAOHUN
much.
staff
Thank you.
and all
Thank you
the
so much,
participants.
everyone.